Hi, today I'd like to talk about loan closets and the process necessary in order to provide your patient with an Apria nebulizer or portable oxygen without them having to wait for a delivery. Think of a loan closet as an Apria truck right in front of your facility. We will discuss the necessary paperwork to successfully provide the needed equipment with the least amount of rework or confusion. It all starts with a valid prescription.
Nowadays, most insurances follow Medicare guidelines and their written order prior to delivery or WOPD requirements. The prescription can be an electronic order, a PAD-RX, or one of Apria's fax order forms. The patient's name, date of birth, ordering date, and the items being provided are all requirements. Usage is next, such as every 4 hours or is needed for a nebulizer, and whether the order is for nocturnal or 24 hours for oxygen. With oxygen, the liter flow is needed, as well as the method of delivery, such as via nasal cannula. The length of need is required as well, 2 months, 99 months, etc. Next, you need to ensure that there is a valid diagnosis on the order. Remember, wheezing is a symptom, not a diagnosis. And finally, the physician's signature with the date next to it, along with the NPI number, makes this a valid written order prior to delivery for both Medicare and all other insurance companies.
Remember, a valid WOPD requires the patient name, date of birth, order date, the item being ordered, the frequency of use, the length of need, a qualifying diagnosis, along with the physician's signature, the date they signed it, and their NPI number.
Next comes the Apria Healthcare Sales and Service Rental Agreement, which we will refer to as the agreement from here on out. It is very important that this be filled out completely and accurately, since this document will be used for proof of delivery, billing, assignment of benefits, and Federal Drug Administration compliance. And it will ensure that the right follow-up and possibly additional equipment such as home oxygen is provided to the patient in a timely manner. The top of each page needs to be completed. The use of a sticker for the patient information is acceptable, provided it has the necessary information and is on each page of the agreement. Yes, I know it's a long document. Sorry, that's legal stuff. The first page shows the equipment being provided. Make sure the serial number, in the case of a nebulizer or other equipment, or the lot number when dispensing oxygen is noted here. The oxygen lot number is critical for Federal Food and Drug Administration traceability requirements. Oxygen is a regulated drug and must be treated as such. The signature of the person getting the equipment is required. If that person cannot sign for some reason, for instance, if they're too young, asleep, or physically unable, a parent, a spouse, or other relative, or someone with the patient's power of attorney must sign. Don't forget to fill out the spot for why the patient could not sign, and make sure the patient's name and the signer's name are both on the appropriate lines. The billing city, state, and zip code come next. Please verify this with the patient. A valid phone number, and preferably a cell phone as well, helps to make sure that we can make patient contact.
On the first page of the agreement, you start at the top. Fill in the order date and time, and then the patient's name, physical address, along with a P.O. box if necessary, their phone number, along with a cell phone if available. In the middle of the page, you have a place for the serial number or the lot number for oxygen. These are critical. The next few pages are pure legalese. You do need to put the patient's name, address, or a sticker at the top of each of these pages, however. Finally, we come to the last page of the agreement. At the bottom of the agreement, there's a place for the patient to sign as well as date. If the patient cannot sign, a guardian or someone with power of attorney may sign. Please put the relationship to the patient and why the patient could not sign in the box to the right. Finally, the address goes on the bottom of the page.
If we can't contact the patient by phone, we may not be able to deliver in the time frame we'd like to. At the end of the day, we all want the same things. Get the patient the equipment they need in the time it is needed. Bill the insurance company appropriately, saving the patients from unneeded expenses, and most of all, get the patients back to health as soon as possible. This all sounds like a lot, but the safety, well-being, and finances of our mutual patients can be impacted in a positive manner by taking the time to complete these steps. Thank you for choosing Apria Healthcare as your home medical equipment respiratory therapy partners.
Hi, I'm a respiratory therapist with Apria Healthcare. Today I'm going to demonstrate how to do an oxygen setup and a nebulizer setup as well. Okay, so we're going to start with the oxygen. You're going to have your portable tank. Make sure it's nice and secured, nice and tight. You're going to have this seal on your tank, and what that indicates is that it is a full tank. Okay, so you want to go ahead and break this off. Okay, you're going to have one hole on one side and two on the other. Okay, that's going to be for the regulator. Okay, there's going to be 2 pins and then one on the other side. So what you need to do is you need to go ahead and place it on and make sure the holes and the pins line up. There we go. You want to go ahead and tighten this. So this gauge here is going to tell you how full the tank is, okay? And it'll let you know if you're getting low. So now that we have that nice and tight, you want to take the key and you're going to go ahead and open the tank. You're going to turn it about halfway. Okay. Then you want to get your cannula and you're going to connect it. Make sure that is nice and tight. Okay. So you're going to take your cannula and make sure the prongs are going in and up into your nose, okay? So what you're going to do is you're going to place it like this around your ears, and this will tighten it, okay, if you need to secure that. Okay, so now that you have that on, you want to go ahead and turn the dial to the liter flow that the doctor recommended for you. Okay, and finally, make sure you educate your patients to not use any oil-based facial products, and of course, no smoking while you're on oxygen. Next, we are going to move on to a nebulizer setup. You're going to have your compressor, you're going to plug it into an outlet, okay? Make sure that your hands are nice and clean. You're going to grab your tubing, and you're going to plug one end into the compressor. Okay, then you're going to get your nebulizer. You're going to connect the other end here, and you're going to take off the top, that way you can dispense the medication into there. Okay, so you'll just pour the medication in there, put on the top, and then you're ready to start your treatment. So you're going to turn on the compressor, okay? And then what you're going to do is you're going to put your mouth around the mouthpiece and just inhale and exhale normally. It's best to, when you inhale, just hold it for a few seconds, and then you can go ahead and exhale. This treatment usually takes about 8 to 10 minutes. You'll hear a sputter when the medication is done, and then you can go ahead and just turn it off. You want to go ahead and disassemble your equipment, and you want to wash your nebulizer and your mouthpiece, or if you're using a mask, you want to wash it out with just warm soapy water and just let it dry, and that way you're ready for your next treatment.